Good afternoon, sir. My name is Sean Esperano. I am a student nurse from DMC. And today I'm going to perform your neurologic assessment. The purpose for this is to make sure we know that your cranial nerves are still normal and they're reactive. So I'm going to ask you a few questions and perform some tests, and you're just going to follow them if it's okay with you.
Nice kid.
So first off, may I please know your name, sir?
I am in Batio.
And do you know what the date is today, sir?
It's March 1, 2026.
Okay, sir. So, may I please see your name tag if confirm you came. Okay, Mr. Bation. So, do you know why you are in the hospital, Mr. Bation?
Yes, with it.
Okay, sir. So, first off, we're just going to perform your cranial nerves. So before that, I'm just going to prepare. I'll be right back. Okay, sir, I'm back and I'll prepare all my stuff for the cranial nerve exam. So first is cranial nerve number 1, olfactory. So sir, pwede niyo imong mask. Pwede mo describe kung pwede niyo masimot ni sir. Masimot pwede niyo describe kung sa iyang baho.
Mint.
Okay. Wala na rin ba? So, ano ito sa cranial nerve number 2 sa pupils 2, 4, and 5. So, assuming na yung chart na sa tubangan, pwede mo matabunan yung picas either sir. Then, so yung letters na
A, W, 3.
pwede yung sa other side mo sir.
A, W, and then Y.
Okay sir. So, ito sa pupil niyo, pwede, can you open your eyes sir? I'm just going to pearl. So pupils is equally dominant reactive to light and accommodation. So I have 6 cardinal movements, sir. So sir, ako lang ito yung mga trace ka sa mukha ng pen. Okay. So next one sir is Nerve 7, is in facial. So, pwede ka mo smile, sir. Then mo frown. Hindi ka na mangisog. Okay, sir. So, next up is cranial nerve 5. So, sir, okay na magpuli ka po sa mukhaan, upping, munawang. So, sir, can you please clench your jaw? And ma-feel yung mukhaan, kawat. Okay, sir. So, next is yung mukhaan. Tingnan ko, ma-feel niyo mo sa both sides yung namon yung pantamot.
Ma-feel. Ma-feel. Ma-feel.
Okay sir, so next is cranial nerve ready to swallowing. So assuming that this is a cup of water, and pwede para niya makabuloy. It is to know that if the patient is able to swallow well. Can you please drink this, sir? Did you swallow it well, sir?
Yes.
Okay, sir. So next up is, so now that we're done with your swallowing test, so can you please open your mouth, sir? So the tongue is midline, and next is cranial nerve 11. So can you please shrug your shoulders, sir? And can you move your head side to side? Okay, sir. So can you put this with back in normal? So next is sensory sensation. So sir, so assuming this is the sharp part of the teeth, and this is the dull part. So can you please close your eyes, sir, and describe to me if this is sharp or not?
Sharp. Dull. Dull. Sharp.
And it's also important to test the lower extremity too. So sir, can you please describe to me if it's sharp or dull?
Sharp. Dull. Dull. Sharp.
Okay. Next is, since we don't have a reflex hammer, so I'm just going to use the hard enough my stethoscope to check if there is check this reflex. So first, this side here. This side, sir. So can you please stand up there? Okay, so after that, sir, can you please remove your slippers? I'm just going to check if your toes can curl. Okay, so everything seems to be normal. So sir, can you please stand up, sir? And this is to check your balance. So can you please close your eyes and just stand? So just to check the patient's balance, and it's okay if the patient sways here and there, and it's important to make sure you have both of your arms at the back and at the front, so that the patient, you can catch the patient if it falls, so the patient can balance on its own. So sir, can you please open your eyes? And next is to finger to nose test, like this, sir. Yeah, so can you please close your eyes, sir? And again. Again. Okay. And the last part is to make sure if the patient is able to walk. So sir, can you please walk forward there? You can open your eyes. So come back to me, sir. Okay, so thank you for that, sir. You can sit down now. So it looks like all your frenulars are all working in the neurologic assessment. So thank you for that, sir. Right, so after performing neurologic assessment, it's more to document and to do aftercare. So, sir, thank you for letting me perform neurologic assessment on you, and I'm going to document all my findings and put you in a comfortable position.